Thank you for the introduction. So as cardiac pressure gets into the brain pulsates. And brain compliance steps in to maintain a stable intracranial pressure. The volume inside the skull obviously is constant, so there is a dynamic interplay between blood, CSF, and brain tissue. However, as we get older or with pathology, this system is disrupted. For example, the brain stiffness decreases, the vascular stiffness increases, so we ask ourselves what we can do to detect this modification early so we can intervene. So what we can do is use MRI, right? But it's a tricky problem because the brain compliance involves multiple compartments. For example, you have the macrovasculature with the arteries delivering blood, the cardiac pressure, then this is the compartment of the fast velocities. The cardiac pressure then gets into the tissue, leading to displacements that will then eventually push the CSF around, which is another compartment of slightly slower velocities. So if we want to characterize brain compliance, we need to characterize each one of these compartments, and then we can derive metrics such as intracranial pulse wave velocity, strain mapping, and intracranial pressure. However, to measure these signals, it requires elaborated signal preparation and usually large gradient fields. So this places a heavy burden on the sampling trajectory that we want to use. It should be one that is versatile and that is efficient. So spiral readouts fit the description pretty well. It's an efficient sampling trajectory. You can cover a large portion of case space with one spiral arm. It offers the opportunity for longer readouts if you want to spend that signal preparation that you made. And if you use center-out spirals, also you have short echo times which are more robust to motion. However, spiral sampling patterns are sensitive to B0 of resonance and gradient imperfections. But recently, there has been many advancements on these corrections. For example, if you include extended signal modeling or encoding, you can use B0 mapping, sensitivity mapping, or concurrent field monitoring to correct for these imperfections. So our study objectives were to probe the feasibility of using spiral readouts for the assessment of multi-scale brain dynamics, and for fast and slow velocities we use 4D flow. We then compare with a radial readout, and then to assess tissue displacement we use displacement encoded with the stimulated echoes. We had 5 participants. They were scanned on a 3 Tesla system, and here you can see some of the scan parameters that were used for the 4D flow MRI acquisition. The images were retrospectively reconstructed into 10 time frames, and the radial scans matched the resolution on the scan time of the spiral scans. And in the images, you see some examples of the sampling trajectories for the spirals. So we designed short readouts for the high Venc acquisition in order to reduce chances of signal dropout due to inflow concerns. For the low Venc, inflow concerns were less of a concern, inflow effects. So we designed longer readouts because with low Venc you have these large bipolar gradients, so your TR gets longer, and to avoid extending your scan too much, you want to cover as much case space as possible per each excitation. So for the 2D dance, we use a single shot spiral readout, and the images were prospectively gated to 10 time frames. And here we have some examples of the low Venc images. If you look closely at the magnitude data from the spiral readouts, you can see that there is higher vessel depiction and conspicuity in the brain parenchyma compared to the radial readouts that look a little bit more blurred. However, if you look at the edges of the brain parenchyma on the spiral images, you can still see some of those of resonance chemical shift effects from the subcutaneous fat that lead to some blurrings at the edges of the brain. But if we look at the velocity images, we see a much higher definition of, for example, here of the cerebral aqueduct on the spiral images when compared to the radial images. So during the iterative reconstruction, we made a trade-off of giving up SNR for higher vessel depiction, or in this case, the cerebral aqueduct, where the radial images are more blurred because of the trade-off between having motion robustness and undersampling the higher frequencies in case space. So the CSF profiles along the cerebral aqueduct look much better using spiral readouts compared to radials. And we believe the main reason is that the cerebral aqueduct is quite small, 1 to 2 millimeters, so it's quite sensitive to partial volume effects or blurring effects, which seem to affect more the radial images. So for low Venc acquisitions, it seems like a spiral readout is a better option. And a similar result was found for the high Venc scan. You see higher vessel depiction in the spiral scans, but you have a lower SNR compared with the radials. If we look closer to the velocity vector field, we can see that the spiral images are more noisier, and there is more variation along the distribution of the velocity vector. And if we quantify flow along the internal carotid artery, if we look closely for the radial images, there is an apparent underestimation of flow, but this is due to the effect that we kept the same region. We use the same region of interest for both scans, so because of the blurring effects, again, it seems that you get an apparent underestimation of blood flow. However, for the high Venc scan, it seems that it's best to use a radial readout because a radial sampling, because you will have shorter readouts, and for the vessel sizes that we are imaging here, you still get good blood flow profiles. These are some dense images. You see these are displacement images. You see a superior slice of brain tissue, another slice at the level of the lateral ventricles, and a more inferior slice at the level of the cerebral aqueduct. And as you can see, brain displacement can be quite complex. If you look at the mid-slice, left to right motion, you can kind of see the interplay between CSF and tissue contraction and expansion. So if we quantify these images and plot the displacement along the cardiac cycle, we see that brain tissue has very tiny pulsations, but as you get closer to regions where there is more CSF motion, you start seeing these larger displacements of tissue, more specifically in the superior to inferior direction. So if we combine all these modalities, we can get a picture of a multi-scale brain compliance. For example, here you see how the cardiac pressure comes into the internal carotid artery. This leads to tissue displacement, which eventually seems to push CSF in and out of the brain. And we can use this information to characterize all the parameters that I mentioned earlier. So to conclude, the take-home points from this study were that it's feasible to perform a multi-scale assessment using spiral readouts. From the 40 flow data, we found out that you can get sharper, more detailed images using spirals. However, at the cost of SNR, they seem to be better suited for low Venc scans. And radial sampling seems to be better suited for higher Venc scans, although you know that there will be, you have to take into account blurring and partial volume effects. And tissue displacement quantitation is feasible using single-shot spirals, using 2D dens. We have semi-validated this approach using optical imaging, and now we need to do more regional analysis, looking at changes in displacement in gray matter and white matter. We are still sensitive to V0 of resonance, especially for the longer readouts. We can correct some of them during the reconstruction, shifting the center frequency, and potentially do other things, but at least there are potential solutions to this problem. And with that, I would like to thank you for your attention, and we'll take any questions. Thank you.